Well, developing now at 9, Florida plans to be the first state in the U.S. to eliminate child vaccine mandates. Physician groups and other health organizations have long considered vaccines both safe and the most effective way to stop the spread of communicable diseases.
Florida's Surgeon General announced the decision today, calling current requirements in schools immoral intrusions on people's rights, as the mandates hamper a parent's ability to make decisions for their own children. And the news could impact the nation already. Democratic governors of of Washington, Oregon, and California announced an alliance to safeguard health policies.
Yeah, our Ben Dennis joining us live tonight in Northwest. And Ben, there's a lot of pushback already here in the DMV against that plan.
That's right. Most of it from the medical field. They say that this is nothing but bad news for Florida, at least initially, and neighboring states in terms of the number of illnesses that kids and other people could contract. Now, back here at home, there's no evidence to suggest that D.C., Maryland, and Virginia could follow Florida. But what's happening in the Sunshine State, it's controversial.
Decades of work to vaccinate children and prevent serious illness like measles, mumps, and polio may come to a screeching halt in Florida.
Working to end all vaccine mandates in Florida law.
The Surgeon General there getting the approval of the governor. But pushback has been swift, including in the DMV.
I do believe in people's ability or right to choose what they want to do for their children. I will continue to have my child vaccinated.
I'm scared for our children's safety and health.
Mom of 2, Valentina Stackel, has concerns.
There's a lot of diseases that can be very dangerous, especially for immunocompromised children. And that's why it's so important that we have to have vaccines for these children.
Is this decision rooted in any scientific fact that it would keep kids safe?
No, short answer.
Dr. Richard Ricari at George Washington University School of Nursing says the return on investment for vaccines is incredibly high. He also worries about people traveling unaware that they're sick.
They're going to be transmitting that on the subways or, on the trains, in the planes, in the automobiles, in restaurants.
It's one of the dumbest ideas I've ever heard.
Howard County teacher Paul Lemley is president of the Maryland State Education Association. He's among those in teaching groups befuddled by the news out of Florida.
Maryland is a place that takes the health of its kids seriously. Obviously, Florida isn't that.
In Virginia, the president of the Arlington Education Association says if you subscribe to the idea that educating students must be a community effort, then there has to be a tacit agreement to keep each other safe.
Dr. Riccardi says the best people to talk to about your family's health, that's a doctor, a physician, or nurse practitioner. I reached out to teachers in Florida. The Florida Education Association says in part, quote, "Is this really about keeping students safe, or is this simply about playing politics?" In Northwest, Ben Dennis, back to you.